My name is Aisha Bawa. I'm a midwife with the Ghana Health Service. I completed my nursing education at the Confanoche Nursing and Midwifery Training College, after which I served for a year for my internship at the Confanoche Teaching Hospital. So from there, I was given an appointment to work with the Ghana Health Service at the Menchia District Hospital. And currently, I've worked for 8 years, and I am a midwifery officer now. So as a midwife, and have been working for 8 years now, it has not been so easy. And one thing I like best about my work is after delivering a woman seeing that joy in the woman with her baby, and the joy whenever the woman tells you, "Mami nurse, me dase." That's one thing that really inspires me as a midwife. And I think it has been my source of inspiration to be doing a lot as a midwife in the service. And always I would like to see mothers and babies. So basically, if a mother delivers and then the baby is fine, the mother is fine. The mother is thriving, the baby is thriving. That's mine. So if I help a woman deliver safely, that is helping a baby to breathe at birth, and then also ensuring that the mother is safe during delivery, and then reducing maternal mortality is my main goal as a midwife. So as a midwife, I play a major role in ensuring that mothers and babies are safe, and then all deliveries are also safe. And as a country, as we realized some years back, the maternal mortality ratio was high. Current maternal mortality ratio in the country, I believe as a midwife, I have a major role to play in preventing maternal and perinatal mortalities. And one of my major aims is to see every woman happy. Delivering a woman and then seeing that joy on her face and hearing that baby cry, it's a source of motivation for me as a midwife. So as a midwife, seeing a woman through the prenatal care, through to the ANC, and then to the delivery room, and then again to the postnatal services safely, it's my major aim. And above all, a woman who delivers safely with her baby and normally tells you, "Mami nurse, me dase," I think that one has been a bigger source of motivation for me as a midwife. And I continue to get those, or look forward to hear those comments from the mothers, because as a midwife, I believe for a patient to tell you thank you goes a long way to help you in your daily activities. It also inspires you to do more. And again, with that, I also look at ways of helping babies and mothers be the best that they can be. And as a midwife, I've been able to do a lot of things. So in the quest to save life as a midwife, sometimes we try to do our best. We try to save the mothers, we try to save the babies. But I get to a point where sometimes there's nothing much that we can do, and we lose some of the babies especially. And I think that's the saddest moment to me as a midwife. Like for seeing a woman who has carried a baby for 9 months, and then at the end of the day hoping to go home with a baby, and then sadly it happens that the baby, she didn't get the baby, or sadly it happens that we lost the woman. It's very sad. Sometimes as a midwife, normally I'm not able to carry myself well when such a thing happens, because normally you see the family members, sometimes they are crying, and as a midwife, you are supposed to comfort them, you are supposed to also talk to them, console them. But it gets to a point as a midwife, you cannot hold yourself, and you also have to share their it's not so easy losing a baby, because after 9 months of pregnancy, and then the woman's expecting that she goes home with her baby, and the unfortunate thing happened. That's if the mother loses her baby. Normally what we do is we try to talk to the mothers. We have to allow them fine to cry, do whatever they want to do. Sometimes they just want to cuddle their babies, and we allow them, and then we also give them emotional support. And normally what happens is after a baby dies or after a woman dies, there's something that we call maternal or perinatal audit. So after the audit, there are some recommendations that come out from the audit. And based on the recommendations, we also try to track the mothers. If the need comes that we have to follow the women to their houses, we refer them to their we refer them to the public health nurses, where they follow them up. If there is any advice that we have to give them, sometimes the women need some advice, some kind of medical advice, and then social advice that we need to give them. So we refer them to the public health nurses, where they also trace them in their communities. If it has to do with them coming to the facility, we invite them, we talk to them about what led to the death of their babies, and then what are the things that we can make sure that we do so that in the subsequent pregnancies we don't experience such occurrences. And I think it has been a good thing, because looking at way back, though we were doing it but it wasn't so strong, but looking at what we are doing now with our audits and the recommendations that come out from the audit, we are able to bring the mothers on board and then discuss with them as to how to prevent future occurrences. Being adjudged the National Best Nurse for 2021, I think I should say I'm very happy. I'm very happy, because it's not so easy, and people will be wondering, what has she done? What is the reason why she was chosen as the best nurse? And one thing I have to say is that as a nurse, whatever you do, wherever you are, whatever you are doing, everybody is seeing it. God is seeing you, your superiors are also seeing you, and there will be that day that the whole world will get to know whatever you are doing. And one thing that I will always say that is good to acquire the certificates, is good to get the academias and everything, but then how to implement it in your work is the most important thing. We have people with first classes, they have the degrees, we have all the certificates, but we come back to the workplace and then we don't see that change that we expect to see with that certificate. So what I always do as a midwife, I think something different that I always do is that I make sure that wherever I am, I make a change. I always make sure that when there is a problem, I use my own instincts to solve the problem. And there's one, wherever you are, we don't always have to wait to get the equipment, all the equipments that we need, because definitely we are not going to get all of them, the ones that we expect to get. We always aspire to be working in the better conditions, which I believe some years to come we will get there. But for now, in the interim, what are you doing as a midwife? What are you doing to make that difference? What are you doing to make that change? Because for now, we need to concentrate on how to curb the rate of maternal and perinatal mortality in the country. So what I normally do as a midwife is, if I go to work, if there is something that we need to do, I just sit down. I'm very innovative. One thing about me is I'm very innovative. I sit down, just plan as to how best we can solve an issue. And I use my own ideas, and sometimes from the perinatal audits that we've been doing and the maternal audits, the recommendations that come from our audits, I use that, and then I try some together with my team members at the Mencha District Hospital. We try to come out with solutions that will ensure that we don't record such a case. So one thing I normally do is I'm innovative. I try to improvise, if I should put it that way. I try to improvise a lot. So if there's something that we need that needs a huge amount of money to purchase, and I think, oh, in my own small way, if we should do it this way in the interim, it will help, I normally do that. And normally, when I set myself to do something, I make sure that I do it. If it's even going to take me the whole day to be at the workplace to make sure that the thing is working, I ensure that. Because one thing I've realized is nursing, we have a shift system. Some come from morning, afternoon, evening. And if you are implementing a new thing and you yourself, you are not there, or you are not able to hand over to somebody who is very reliable, at the end of the day, you get it not being done. So one thing I always say is innovation, because in our part of the country, we don't have all the sophisticated equipment to work with. But what are we doing as midwives? Should that mean we should sit down? Should that mean that, oh, if we are not getting this to work, you should do this? But we are praying that one day to come, all our dreams will come to pass, and what we expect to work with, we will get it. And again, the things that we do to help the women. When you look at my facility, for instance, the place most of the times is overcrowded. When you come to the maternity ward, you see women on the floor. There was a time that a video was even released from our facility where pregnant women were lying on the floor after delivery. Some were even delivering on the floor. Yes, we don't have that infrastructure. But then, currently the Otumfo's wife, that's Lady Julia, came in to help us, and now the project is ongoing. They are helping us to build a maternity block for us, because sometimes we are overwhelmed with patients and we don't even get space to put them. So as a midwife, I've done a lot. I always try to come out with things that will make the work easier, since we have a higher patient number. Looking at the kind of women that come to our facility, normally the place is almost overwhelmed with patients. What new thing do you think when you do, you are going to help save lives? So there was a time we went for a workshop, Helping Babies Breathe workshop, where they provided us with newborn examination forms so that we can monitor the babies with. So what I did, together with some doctors at Menchia Hospital, Dr. Danson, and then Dr. Mary Amoa, what we came up with was that we modified the newborn examination form in a color-coded form, so that anybody who picks the form to assess the baby will easily know that this baby is in danger. So we used 3 colors. We had green, we had yellow, we had red. So if you are assessing a baby and you realize that the baby is getting yellow, it means that the baby is having a problem. So we need to pay much attention to the baby. And if you are marking and you realize that the baby is getting red, so all the indicators are there with the colors. So if you're marking and you see that the baby is getting more red, it tells you that the baby is in danger. So we need to inform the doctors. Because we came up with such thing because we realized the babies were so many. At that time, when we were having the midwife number was somehow okay. But then that one was helping us to detect the danger signs early and then be able to tackle them easily. So it has really helped, and those are some of the innovative things that we are doing. Even when we look at the charts that we are monitoring our cesarean section women with, we also modified a chart from Konfanoche Teaching Hospital. That's the Muse chart, and that one too was done by myself and Dr. Adakwa. He was our gynecologist and obstetrician by then. So we also came up with that, and then we also did that one in color-coded form. So anybody who monitors a woman and then realizes that the woman is getting more yellows, the woman is getting more red, meaning we need to prompt the doctors so that we can intervene easily and then save the lives of the women. So basically, I would say that there's a lot that I've been doing since I started work. I started facilitating. That is, I'm a regional facilitator for Helping Babies Breathe and the newborn issues in the region. Normally, I've been doing a lot of trainings. We go to hospitals, we train midwives on how to resuscitate babies. We've done a lot of trainings in the region. And another thing too is that there are a lot of things. It's like they are numerous. I don't know which one to start from. And I think this is the second time the Ghana Registered Nurses and Midwives Association is holding such a thing. That's the National Awards. The maiden edition was done last year, and this is the second time they are doing it. And all this while, I've been working, doing a lot of things, and I didn't even anticipate there will come a day that I will win such an award. And I should say that there are a lot of things that I've done. So as I said, I'm a regional facilitator for helping babies breathe and essential care for every baby in the region. And then during the time of, as I should say, when COVID came, in that era, I also did a video which went viral on hand washing. You know, within the Muslim community. So it got to a time I realized that everybody was coming up with things to educate the public on COVID-19. So one day I just closed from work. I was just here like that, and my husband was here, and I told him, look, can you help me do something? He said, what? And I said, oh, I've seen people doing a lot of education on COVID-19. But one thing I've realized is that for my community, I think they are being deprived because I've not heard anything so far on Hausa language, especially the hand washing, because that was very, very important to prevent COVID-19. So what I did was, just from workplace, I just gave him my phone. He recorded me, and I started. My Hausa is not so good, but I tried to do it. So I recorded a video on hand washing, how to do hand washing, the importance of hand washing, how they can even use the kettle, that's the butter, to do hand washing, because people normally think that, oh, if I don't have a source of running water, like a pipe or something, I cannot do it. But I try to do it even with the butter, so that it will become very easy for them to understand and be able to also implement it. So I did a video, and then I was just sharing it on my social media outlets, and then eventually I was there the following day. Somebody called me that, oh, Multimedia, Love FM, they wanted to share the video on their page. And I said, oh, it's okay. So then subsequently I realized that the video went viral. And then also I've been doing a lot. I don't know which one to say and then which one to leave out. And I also do a lot of radio and TV education. Most of the times I go and they invite me. We need you to come and talk on this topic. I go and then do the education on TV and then on radio. And then I'm also a preceptor for Garden City University in my facility. And aside that, I have most of the innovations that I mentioned, and I think I presented that because we went for an interview. It's not that they just chose me as a national best. So the interview, it was through the facilities. We started with the facilities. Every ward brings the best nurse for every facility. So after the facility interview, I came up as the best, and they presented me to the district, which is Kumasi Metro. So we also went for an interview at the Kumasi Metro level. That's the facilities under KMA bringing their best nurses. And then after the interview, I also emerged as the winner again. And they presented me to the region. So the region, every district in the region presented the best nurse. And when we went for the interview, we were many, we were around almost 40 something. And so when we went for the interview, again, they called me that they've done a short list, that we need to come back for the interview. So we were 5 and we went back for the interview again. So the regional level, the interview was done twice, where I emerged the winner, and then I proceeded to the national interview. So at the interview, you present all your innovations, the things that you've been doing, everything that you've been doing as a midwife or as a nurse that you think you are supposed to be giving the national best nurse. You present them. And that is exactly what I presented, the charts. And there is one key thing that I've also done. That's a transport trolley for newborn. That's the newborn babies. So this trolley, I don't know, maybe I'll give you the picture so that you see it. I realized that adults normally have a trolley that we can transport them from one ward to the other. or taking them to the diagnostic centers and stuff. But it got to a point through our audits and then recommendations that were coming up, realized that the babies were not having such a thing. Normally, if a baby is born and the baby is not breathing well, and the baby is being resuscitated at the theater or the labor ward, after the resuscitation, they think the baby is somehow fine. They just hold the baby, rush the baby, they will be running to the MBU, to the NICU. But ideally, the baby is supposed to be ventilated on the way to the MBU or the NICU. So, with the recommendations that were coming out from our audits, we sat down and then I realized that, no, we need to get something for the babies. Though we have some of these trolleys with a form of bassinets and stuff that we transport the babies. But we realized that normally the babies need a source of heat. And then we should get something which is almost like a flat surface so that we can be able to ventilate the babies. And then we also need an oxygen port, because sometimes we send the babies to the x-ray, we send them to the diagnostic centers in the hospital. Meanwhile, we are not using the oxygen. Maybe the baby probably might be on oxygen, but because we want to go and do an x-ray for a baby or something, we rush the baby and then back. But ideally, the baby is supposed to be on it throughout the journey, or like taking the baby to the diagnostic center. So I also thought it wise that, we should attach a mini oxygen to that transport trolley. So I was just there, I just took a paper and I drew it how I wanted it to be. And I have this welder, and I called him and I said, look, I want you to do something for me, but I don't know how we are going to do it. And I showed him the picture and he said, okay, if that's the case, we can get like the normal trolley that we use on the ward for like the medication trolley, the normal trolley. Okay, so I really want to express my profound gratitude to the Ghana Registered Nurses and Midwives Association for this wonderful initiative. I'm very, very happy, and then I'm very proud today to say that I'm a member of the association, and want to thank the national executives of Ghana Registered Nurses and Midwives Association, led by Mrs. Perpetual Furian Pofu. I thank them very much for this award. Again, to the regional executives, I cannot do this without you. And I really appreciate all the support. Mr. Jones, Efriye, Anto, I'm very grateful to you. Then to the district executives, Kumasi Metro, Politan Assembly, KMA, I'm very, very appreciative of whatever you've done, and I thank you very much for also having the trust in me to present me to the region. And again, to the Regional Health Directorate, Ashanti Regional Health Directorate, to the Regional Health Director, the Chief Nursing and Midwifery Officer, in the person of Mrs. Ama Enchiwa, I'm very grateful to everybody who have supported me come this far. Again, to the management of Menchia District Hospital, I couldn't have come this far without you. And all the staff of Menchia District Hospital, they've been very, very supportive, and I thank you very much for helping me come this far. I would like to also acknowledge some people that basically they are pediatricians, because I've worked a lot with pediatricians. They've encouraged me, and I should say they are part of this success story. In the person of Dr. Rita Yeboah, she's the newborn focal person for Ashanti region. Dr. Ashura Bakari, Dr. Prisla Wobil, they've helped me a lot. And then Dr. Koko, and all the pediatricians in the region, I really appreciate it. I'm very grateful. Again, to the CEO of Women's Health Wealth, Auntie Abena Ekwiyama Boateng, I'm very grateful. I should say she discovered me. I started facilitating because she was the one who ushered me into it, and I started facilitating HBB, ECEB, and Auntie Abena. I'm very grateful to her. Again, to my family, I have a very supportive family, my husband, my sisters, my brother, everybody. I'm very grateful. Mr. Akim Haruna, he's my husband, and he has been very supportive, because coming this far, it wouldn't have been easy if you don't have a supportive husband, because being a nurse, sometimes I stay back home late and other things, but yet still he has stood by me all this while. I'm very, very grateful to him, to my dad, Alaji Bawa, my mother, Hajia Fati. Spiritually, they've been helping me a lot, and may the Almighty Allah bless them. And again, to the entire staff of Menchia District Hospital and all the staff in all the facilities in Ashanti region, I'm most grateful to everybody. And above all, I'm grateful to the Almighty Allah for bringing me this far. I couldn't have done this without the help of Allah. And as I always say, when you trust in Him, everything will be in the right way. Thank you very much.
Okay. Okay. Okay.